You have knee or shoulder pain and you've been wondering if there might be options for treatment to give you some pain relief that doesn't involve surgery. Tonight, we're going to be educated by Dr. Kelly Cunningham. He's a board certified orthopedic surgeon in Austin, and we're going to be learning all about the different types of therapy. So, Dr. Cunningham, let's start with we've heard the term biologics, perhaps, and maybe been a little confused of what that actually means. Let's start with what that means.
Sure, Kim, and thanks for moderating. I hope people will find this helpful. So, I'm an orthopedic surgeon, but a few years ago, I began delving pretty deeply after some study abroad, uh, 20 plus years into my practice, into a field called orthobiologics. And orthobiologics is taking some of the natural substances from your own body, such as stem cells, or better known as cell therapy, and platelet-rich plasma, PRP, and using those to treat bone and joint conditions, early arthritis, sports injuries, instead of or in conjunction with surgery. So what you see here is a good schematic representation of one of the two different modalities that I've begun to use much more frequently over the last 7 to 8 years. These are cellular based treatments from bone marrow or from fat cells. I
Mhm.
primarily use cell based therapy from bone marrow. And what we find that these treat are the pain levels and increased activity desires of my older athletes. We often refer to my business now as mature sports medicine. And we find that as we age, we have different aches and pains than we did
Mhm.
in our 20s and 30s for
Mhm.
sure. So, stem cell is the one that I use for the more severe, moderate to severe arthritis, primarily of the knee, the shoulder,
Mhm.
the hip, elbow, and ankle. I don't really do this with spine and neck, although it is done by other practitioners in other
Mhm.
locations.
Mhm.
And then the second orthobiologic that we frequently use these days, and mostly in an office setting, is called platelet-rich plasma. That's a mouthful, so we shorten it to PRP. This is a very, very up-and-coming treatment that's been used in Europe for decades, actually, and has become quite popular in the athletic world here. This is a schematic representation. You'll see that the plasma color, all of the red cells have been removed by treatment and centrifugation in our office, and we're using actually in the doctor's right hand there an ultrasound to guide the injection of the knee. Again, often an injection involving the knee, the shoulder, or the hip.
And these are ways to be able to sort of, I mean, really just use what's already in your body.
Exactly. So they're not completely risk free, but they're certainly less risky than some of the other treatments, such as steroid injections, obviously surgery. They
Mhm.
can be used in conjunction with surgery, and we'll talk about that a little bit later, Kim.
Mhm.
But now I find that the vast majority of patients come in looking for alternatives to either avoid or at least delay surgery and
Mhm.
often joint replacement. And we found a very willing crowd here in Austin, Texas, of people
Mhm.
who are anxious to try these modalities. And we'll be showing some of the
Mhm.
success rates over
Mhm.
different time periods here later in this discussion.
And going back to kind of the joints that you typically focus on are going to be starting with the shoulder. What kinds of issues do people typically have?
So, in the shoulder, what we often see as we get older, let's say mid 50s and up, rotator cuff tear is far and away the most common. And we also see labral cartilage tears. What we see more and more because of the increased activity of this generation of aging athletes is also arthritis of the shoulder. And we try to catch these arthritic and rotator cuff problems early in the course so that indeed we can avoid surgery. And if not, use PRP or stem cell as an adjunct to surgery to improve healing rates, and most importantly in the shoulder, to decrease reoperation
Mhm.
rates. There's
And then
lots of literature that has shown that is a solid modality
Mhm.
for orthobiologics.
And then when it comes to knees, what are you typically looking at or noticing of your patients?
So typically a knee in an aging athlete is either early arthritis, such as this chart will show us. This is called the Kellgren-Lawrence, KL for short, classification system. One is where you look at a plain X-ray or an MRI, really don't see much in the way of wear and tear. But if you continue through the staging of 2, 3, and 4,
Mhm.
stage 4 is end stage. You'll see the red areas. This doesn't project real well, but you'll see the wear and tear in the two sides of the joint. What I like to do is try to catch people in stages 2 and 3. And we also still see a fair amount of cartilage lesions that aren't arthritic. They're from an injury such as a meniscus tear. We
Mhm.
do still treat ACL tears. That's not at all uncommon in people in their 50s and older, from
Mhm.
ski injuries, pickleball, tennis, running injuries. So ligament, tendon,
Mhm.
cartilage, both knee and shoulder.
And then you just have to look at how severe the issue is to decide if stem cell and or PRP might be beneficial or if it is really going to require surgery.
That's
Right.
correct. For the vast majority, if you're in stage knee, for example, stage KL4,
Mhm.
you're bone on bone. And in those cases, your best option is generally knee arthroplasty or
Mhm.
replacement. However, there are people that will opt to try stem cell or PRP
Mhm.
because they want to buy time. The
Mhm.
problem with knee and shoulder replacement, especially knee and also hip, those are weight bearing joints every day of your life. If you have that surgery in your 40s or 50s, you have a significant chance that you will need a revision surgery sometime in your lifetime, whether you remain athletically active or not.
Mhm.
And so, if you can buy time with platelet plasma and with cell based stem cell therapy, you're going to save your joint potentially a second or additional operation. So time is important for those
Mhm.
mid-range knee and hip injuries, and to a lesser extent, perhaps also in the shoulder arthritis.
And it also sounds too the importance of actually trying to catch things early when things are maybe beginning to feel injured or having problems versus waiting until it gets to feel like bone on bone or really really severe. So the earlier you act, the more likely that one of these kinds of treatments will be beneficial.
Absolutely. If you can, I mean, nobody wants to go to the orthopedist every time they have a
Right.
lump, bump, or an ache or a pain.
Right.
But if something is repetitive and every time you impact or you do a certain sport, you pay the price for a period of days for weeks,
Mhm.
what we typically recommend is when you call in, we do a set of plain standing for the hip and knee, and then a series of different views for shoulder x-rays.
Mhm.
And that kind of gives us a baseline. And then we like to see patients in the office, get a good history, do a good physical exam. And then oftentimes we will follow up with an MRI. And then we can stage these lesions, find out if we really have the option of delaying or avoiding
Mhm.
surgery. And yes, within reason, the earlier the better.
Yeah, yeah, yeah. You don't want to be too proactive and do it just because I think this might happen, but certainly when you start having those issues.
Correct.
Before we go into some of the more specifics of how you do the treatment and how long it takes to recover and all of that, I'd love to get a sense of you are a board certified orthopedic surgeon. You are trained, in medical school to be a surgeon and have done that a lot in your practice, of course. What's really gotten you interested though in finding these alternatives that keeps people from having surgery or at least delaying it?
Sure. So, yes, I developed an early interest in surgery. And early in my career, in my residency training, I was primarily a trauma surgeon, and a lot of orthopedists do that. Now, most of us, as we establish practices in the private world, will delve into certain areas. I did an extra year fellowship between Canada and California in knee and shoulder. And then I drifted off more into the sports medicine realm, less trauma, less joint replacement, more younger athletes. But two things happened. Number one, I was exposed to Dr. Richard Stedman, who is kind of the father of microfracture, which is a very was a very outstanding early treatment of cartilage in the 1990s, and that really piqued my interest in cartilage injuries because it's an area that doesn't naturally heal well. Replacement is one way to treat it, but it would be better if we could fix it. And then secondly, as I have been in practice here in Austin for over 30 years now, I've just naturally seen my patients age. And again, I talk about mature sports medicine. And I found that knee and shoulder arthroscopies and surgeries weren't always successful at age 60 compared to age 20 or 30. And so I really did go looking for alternatives. And I spent in about 2015 a period of several months on several trips in Western Europe, in Italy and France and Germany, where this was a technique that was developed earlier than the FDA approved this in this country. And that's where my interest in this came from. But I'm very, very clear to my patients that I will give you both options, both a surgical option and a
Mhm.
non-surgical option, so that you can make your best informed decision after we have our discussion and lay things out.
Mhm. Who do you feel like are the best candidates for either PRP or stem cell?
So generally, PRP, the earlier in the game, it's less expensive. It perhaps doesn't last quite as long, and we're going to look at those statistics soon. But it's easier to do. It's just a blood draw in the office and about a 30-minute procedure. Pretty straightforward. Bone marrow aspiration cell therapy or stem cell is a bit more complicated and would be reserved for a little bit further
Mhm.
and more progressive knee, shoulder, or hip arthritis. It does tend to last longer, but it is a more complicated procedure in the
Mhm.
office. And often I will do that in conjunction with a minor surgery anesthesia. So it's more comfortable for the patients. The best candidates are the earlier candidates.
Mhm.
The younger you are, the better your cartilage uh, responds to the orthobiologics in terms of the anti-inflammatory approach. And
Yeah.
then the other thing that is important, the younger you are, you tend to respond for a longer period of time. And
Mm.
these treatments, PRP and stem cell, can be repeated. I have numerous patients that have done 3 or 4 series because they continue to work for them.
Mm. Okay. So over time, they can
That's
you
correct.
right.
And we're going to look at some of those time frames here in a minute
Yeah.
so that people can kind of understand what they're getting for their treatment.
Sure. You sort of just started describing the PRP where it's a blood draw, you spin up the platelets, or I'll let you explain exactly what you're pulling to be able to re-inject into the spot, and you showed with the ultrasound. What other things are done, and or what's the recovery like once you go home? Does it,
So the great advantage of doing this exclusive of surgery, which is about 60 to 70% of these injections, is I really don't restrict people other than don't do repetitive tasks. For example, if we inject your shoulder or your rotator cuff, don't go out and trim your trees or paint your house in the next 2 to 3 weeks because it takes a few weeks to take full effect.
Mhm.
And often we will follow that up with physical therapy to
Mhm.
try to maximize the results.
Mhm.
In terms of stem cell, it does take a little bit longer. The cell therapy can often take 4 to 6 weeks, and the same rules apply. No crutches, no braces, no slings. Just don't go on a 10-mile walk with your dog three
Mhm.
days after we do it. Kind of use common sense. As
Mhm.
you're feeling better, start some physical therapy and then gradually fold back into those activities that you really want to get back to.
Mm. And I know a lot of people are going to want to know, does it hurt? When you're in the office, does it hurt, and or do you walk out when if it was a knee, would you still just walk out of the office and just go home to recover?
Great question. The PRP is, I wouldn't say it's painless because it's like any other shot, but the harvesting of it is simply a blood draw.
Mhm.
We have phlebotomists, and I actually end up doing a lot of the blood draws as well. I don't think that's of any huge consequence unless you have some type of needle phobia, but we
Mhm.
have ways and medications to relax people. The bone marrow stem cell is a bit more uncomfortable, but what I can tell you is I've had it done
Mhm.
and I walked away. In fact, I had it done by a good friend in another city. who does it just like I do, and I actually drove home.
Mm.
We don't recommend that because we like to give patients some muscle relaxants and perhaps even a little bit of Xanax. So we prefer them to have a family member there with them.
Mhm.
But I've never had anyone leave kicking and screaming.
But generally, once you get home, the recovery, minus not doing the heavy activities and things like that, it's not as uncomfortable as perhaps a shoulder surgery. I'm just thinking about when my son had his shoulder surgery, and that was a pretty awkward and uncomfortable recovery for a few days. What I'm hearing is that the PRP and stem cell isn't going to have a lot of those same kinds of discomfort.
I would say it for surgery, there's immobilization with
Hmm.
either a brace or crutches or a sling. That's inconvenient. It definitely hurts for a period of a few days, sometimes for a week or more. You just don't see that with PRP or stem cell. You might have a little injection site discomfort that's easily treatable with Tylenol and with ice.
Hmm.
It's one of the great advantages. You really avoid that downtime.
And we are live tonight here with Dr. Kelly Cunningham, board certified orthopedic surgeon. So if you have questions, if you're watching us live, we'd love for you to put those in the comments. And if you are watching the replay, we'd love for you to put hashtag replay so that we'll know that you watched. And if you do have questions even then, feel free to put them in the comments and they'll be looking for them as well in the coming days. Okay, so we've talked about the recovery and what are generally the outcomes that you're looking for with PRP and stem cell.
Well, let's go to a couple of statistical slides, and hopefully these will transmit well enough. So this is a company called Data Biologics, a really value-added company through the pain management and orthopedic world, has been tabulating across a number of clinics in North America for several years. And this chart will compare all of the clinics that are in the Data Biologics world to ours. So if you look at the black line out through 12 months, which is approximately 14,000 patients, believe it or not, and it's growing weekly, versus the purple line below it is the Austin OrthoBiologics, which is about approximately 300 patients. And we picked up on this about 18 months ago. So our endpoint is a little bit shorter. It's at 12 months. But this is a numeric pain rating, 1 to 10. Most patients started somewhere in the 5 to 6 range, which you'll see there. And we feel that the Data Biologics numbers from a large series is quite good. The pain is down below 3 at 12 months, and we anticipate that will, because this is a combination of both PRP and the stem cell, will continue through 18 months. But look at the purple line. Lower is better.
Mm-hmm.
The less pain you have, the lower the line will be. So starting at about 3 and continuing through 6 to 12 months, we actually feel like our patients all across the board. And when you look over to the right, you'll see that the majority are knees, but there's a lot of hips and shoulders as well.
Mm-hmm.
Those patients have less pain than even the baseline pain relief that the clinics around the country are seeing. So we feel this really merits consideration.
Mm-hmm.
This is a procedure that works for the vast majority of people in terms of relieving their pain.
Yeah. Okay. Great. Now let's look specifically at the shoulder results that you've seen so that we can kind of talk about the shoulder effectiveness.
So this is more of an activity rating. This is called the Quick Dash method, and Quick Dash is just an algorithm. Lower is better. The less restriction you have in terms of return to activity at 6, 9, and 12 months, even out to 24 months for the larger series, which again is in this case for shoulders is close to 3,000 patients.
Mm-hmm.
The black line is mirrored quite closely by our purple line, which is approximately 75 patients. We've done many more than that, but these are the ones that have responded to the patient reported outcomes PRO questionnaires that we send out on a several month basis.
Mm-hmm.
Average age 58, average injections a little over 1. So most of these patients don't even need a second injection within 12 to 18 months. We would anticipate that we will mirror the curve of the black line as we
Hmm.
follow our patients further out. But once again, this is a little bit closer, but we feel like we're actually exceeding the improvement of the large group. So we're quite happy with the treatment using both PRP and stem cell of the shoulder.
Sure. And then when it comes to the knees, you're seeing good results as well.
So one more chart to see there. Now this you have to flip in your mind. This is called the Koos knee measurement. Once again, it's an activity level measure, but here it's just a different algorithm. So higher is better.
Hmm.
So what we're seeing is somewhat interesting. There's an immediate improvement in both the 7,000 North America-wide patient group from Data Biologics, and then about 120 of our own patients shown in the purple line. Look at the flattening out after 1 to 2 months, and then pretty dramatic improvement again between 6 and 12 months. With continuation, we would anticipate all the way through 18 to 24 months. And that means that people kind of settle back into their activity level and then kind of take off. We also think this supports doing physical therapy a few months into the treatment so that you get your muscle strength and balance and your kind of kinesiologic or muscle memory back
Hmm.
because we see this late improvement. So once again, I feel like our results for the knee are perhaps even a little better. Same age difference, 50, or same age average age group, about 58.
Okay. Seems to be kind of the average, when some of us start having problems. So
That's about right. I see
yeah,
people all the way up to their 80s who
yeah.
are still snow skiing and playing pickleball. But
Hmm.
yeah, probably late 50s, early 60s is our average group.
Hmm.
So kind of summing those results up, and again, this is a data biologic slide. So this is across the board, across North American experience. 73% of patients feel like they had an improvement in function at a period of 6 months. That's a pretty strong number. And if you break it down into three categories, the platelet plasma, the cellular stem cell therapy versus non-biologics, which would primarily be steroid or what's called hyaluronic acid or a lubricant, or the old folks call it rooster comb. The baseline lubricant and steroid, about a third of patients improve. But we've almost doubled that with stem cell, and even PRP is pretty close. And I think the stem cell number is important. Half of these people improve, but generally there is what we call some selection bias. That
Hmm.
means that typically the stem cell is going to be used for the people that have a bit more progression of symptoms and arthritis. So to see a 50% improvement at just a few months is quite significant, we think.
And when you're talking about those non-biologic injections, what are those generally? Just because people may have heard of some of those.
Again, that's probably mostly steroid. I'm not
Hmm.
real big on steroid anymore. I consider that a somewhat outmoded therapy.
Hmm.
There are all kinds of problems with steroid. They actually speed up in recurrent fashion arthritis if you do them several times a year. They take effect quickly, but they're really not treating anything, and they typically only last for a period of weeks to a few months.
Hmm.
So generally find that steroid is the most common non-biologic in addition to the what we call HA lubricants. They just don't last very long, and they don't have quite the physiologic function, the natural substance function of anti-inflammation that we get with PRP and stem cell. And I think those numbers indicate it. You get a one-third improvement with steroid or HA, but you can get up to a 50% improvement. And I think that will continue to progress to even higher numbers beyond 6 months. So if you look specifically at my practice, at our Austin OrthoBiologic patients, we ran this back mid-fall. 94% of our patients are still satisfied, either very satisfied or enough improvement to rate it as good satisfaction at 12 months at a full year. And that means far beyond the 50% improvement. We're seeing over 90%. Basically, patients saying, yes, I would definitely do this again.
Hmm. All right, thanks for sharing us those. We do have a
Hmm.
question, and this is a little medical, I think. So I don't know if this is one we can cover, but do you quantify the platelets? I have no idea what that
That,
means, but
yeah,
hopefully you
that's
do.
a great question. A lot of clinics will do either test runs or control runs, which is what I do. I send both PRPs and stem cells off to a lab, and we do what we call a QC or quality control. We don't do every single patient because to buy the cell counters is cost prohibitive for a practice such as mine. So we don't do every single patient, but we do enough that we have a good basis of different age groups and different both stem cell and PRP.
Hmm.
So yes, we do like to quantify. We know from studies now, and this is becoming more and more clear on the data, the more platelets you get per dose, the better the effect is across the board. And what we want to do is increase the platelet level by 5 to 7 times.
Mm.
And we've consistently found that in our PRP samples. It's a little less clear what the proper number for cell count is for stem cell, but it appears to be a factor of how much you weigh. It's a number of cells per kilogram, which is the metric scientific way to do weight. And we match our results to those.
Yeah. Do you often find that that OrthoBiologics would help following a total knee joint replacement? You had mentioned that you sometimes use it in conjunction. Would it be in conjunction potentially with a knee replacement?
No, it generally would be with the surgery that's done staging or prior to that.
Yeah.
So if you have a meniscus tear that's occurred because of early arthritis, a lot of those can be injected without surgery and do quite well. Statistics have shown that up to 60% of those injections will actually heal without surgery, but up to 80% of patients never require an arthroscopy day surgery. So if they do, because they've got what's called mechanical symptoms of the knee or the shoulder from a labral tear or a meniscus tear, and they really just can't get relief without surgery, that's where we'll use the PRP or bone marrow stem cell in conjunction. Once you get to the stage of grade 4 where it's bone on bone and you need the replacement, typically that's done with a metallic and plastic inserted knee, and that is a little bit prone to infection. So you wouldn't want to be doing injections on those
Mm.
areas. So it's really more of a precursor to knee, shoulder, or hip replacement than it is as a conjunction. We call it an adjuvant to earlier surgery.
Mm.
We try to avoid surgery now as much as we can. And I would say in my practice, over the last decade, I've probably cut my surgery load by half
Mm.
because of biologics. So
Wow.
it's a significant number that can avoid surgery.
Yeah. Now I know a lot of people are going to be wondering, does insurance cover this?
Sure. So unfortunately, in this country, as opposed to where I studied in Western Europe, this is an out-of-pocket expense, and we try to keep our costs down as much as possible and do as much value added as we possibly can. I think we try to give you options, give you time to think
Mhm.
about it. We don't always recommend the out-of-pocket treatments, but we do find that we think you're getting good value for that
Mhm.
in terms of in conjunction with the limited precursor type surgeries we talked about, as well as initial office visits for patients, for x-rays, for staging, MRIs. All of that generally, I would say
Mhm.
pretty universally, is covered by insurance.
Mhm.
So it's actually only when you decide on the orthobiologic treatment that the out-of-pocket expense becomes something to discuss. And we're very transparent on that.
Mhm. And I would imagine that physical therapy can also often be covered by your insurance after the fact as well,
That's a great point. We
depending on your
showed on
insurance.
the Yeah, we showed on the knee slides that, and there's other shoulder measures. You get that 3 to 4 month kind of down period before you take off in terms of symptom and relief and activity.
Mhm.
And that's why we think therapy is very important. So, yes, almost universally, physical therapy will be covered by your insurance as well. That's a good point.
Gotcha. And you can use your FSA or HSA if you have if you have health spending accounts or a flex spending account.
Absolutely. Flex accounts, FSA, expire at the end of the calendar year, so you better hurry up. But more people these days have the health savings accounts, which are cumulative and can carry over from year to year. And 100% of the biologics are covered by those
Mhm.
two plans.
Are there any downsides or risks to doing either PRP or stem cell?
I think the biggest risk is a practical one. Are you going to be one of the few percentage of people where it doesn't work or is not as effective as we had hoped and would perhaps need a second dose? Again, I would tell you that if you look at the statistics, the average, not only in my practice, but across the board, is one super strength injection. That's why we test our PRP strengths to
Mhm.
make sure we're giving as much as we can and is safe. That's the biggest plus. The biggest minus, really, other than the out of pocket expense, is just if it doesn't work and you have to progress on to a major
Mhm.
surgery or a joint replacement. There really isn't much risk in terms of infection. I've done over 2,500 of these now in the last 8 or 9 years, and I've seen one infection. And paradoxically, that was the one that was done in a sterile operating room.
Hmm.
So I've never had an infection in my office. We think these injections are somewhat bacteria resistant.
Mhm.
Even a steroid or any injection has about a half to 1% infection rate. So if you do the numbers on 2,500 injections, we think that we're doing this in a very safe,
Mhm.
risk-free manner.
And how long do you usually expect that the PRP will provide that relief? Because you mentioned earlier that it's not a one and done it's not necessarily going to last forever, potentially, but how long do you expect the relief to last?
The large series data biologic studies are showing that where we expected PRP to last 9 to 12 months,
Mhm.
we're often getting 18 to 24 months. I
Mm.
would say a conservative estimate would be 15 to 18 months of good
Mhm.
relief and can easily be repeated at that time
Okay.
if you feel like you want to continue on that route. It's a discussion we'll have each time. For
Yeah.
stem cell, it's a stronger product. It has a lot of PRP in it, in addition to the cellular activity and the anti-inflammatory activity, and it often will exceed 2 years. My injection is 2 years and 6 months and going strong.
Gotcha. What what do you think are there any other things that we haven't covered that would be the obvious things that we'd want to make sure that we mention?
Well, there's two things I think. One, people, there's a lot of advertising that occurs in this field. You'll often hear, well, you're 68 years old, you're too old for PRP or stem cell. There's no data to definitively indicate that age is a negative. I use arbitrarily, because of the decreased volume of stem cells that have been noted in studies. In your 80s, probably PRP is going to be more effective at a higher dose or a second dose than would be stem cells. So I would probably use the eighth decade as an endpoint for age. But up to that point, there's no studies that indicate the effectiveness decreases with age for either PRP or stem cell.
Okay. And is that sometimes just based on the type of person that you are, like the physical health that you're in, whether it's just physically and or how strong you are and things like that? Does that come
Absolutely.
right?
Absolutely. I think if you're someone who's blessed with good health, maybe in your 60s you take a blood pressure or a cholesterol pill, but otherwise are healthy, your platelet count is going to be excellent, as will be your bone marrow stem cell count. If
Okay.
you're a person who's unfortunately had to go through a bout of chemotherapy or had a major surgery or take some type of medications that can result in a lower blood count or anemia, those are factors we'll have to think
Mhm.
about, and we'll have to do some pre treatment study to make sure you're a good candidate for that.
Which brings me to if somebody does has been listening and thinks, okay, I would like to get more information about this, or maybe I would be a good candidate for this. What should they do?
So the best thing to do is reach out to my office. We are in Westlake, West Austin. We generally have appointments available same week, sometimes as soon as a few days. We need to get an x-ray if it's a joint problem,
Hmm.
and that will be ordered ahead of time to save you time when you come in. We'll do that at one of the x-ray centers. We'll look that up on the computer, have it ready when you come in, have a
Hmm.
physical exam, go through your history, and then give you options to go home and think about and go from there.
Okay, one other very technical question, or at least in my mind, which is, would you use orthobiologics following a shoulder microfracture with bone proliferation? That's a lot
So
of
micro,
words.
sure, microfracture is, again, I alluded to it earlier with Dr. Stedman
Mhm.
in my fellowship. He was the originator of that procedure. Microfracture is a little bit of a dated procedure now. There are some better cartilage grafting and regeneration techniques. I still use it occasionally. What I'm hearing in that comment is probably some early arthritis and
Mhm.
attempts to form new cartilage by microfracture drilling in a shoulder, and some bone spurs that have come up as a reaction to the arthritis. I find that bone marrow cellular stem cell therapy is probably more successful in early arthritis of the shoulder than almost any other joint I treat. So, yes, that is an excellent indication for
Gotcha.
biologics.
Gotcha. And if anybody has had a practitioner say, "Oh, we can use cord blood or a birth product because that's going to be much more effective," that's a red flag.
Yeah, I'm glad you brought that up. There's a lot of advertising out there, and I will just tell you, you really have to follow this world closely. There are over 300 articles a year written on biologics. It's impossible to cover them all, but a lot of those are regulatory articles. The FDA in 2022 made it illegal to use non homologous, non autologous, and that's a big fancy word for your own stem cells, your own products in
Mm.
PRP. So, birth products from another human, whether that would be placenta or cord blood or what's called Wharton's jelly, first of all, most of those products do not have live stem cells in them. And secondly, they are actually prohibited in the United States
Mm.
by the FDA. There are still companies out there that are in that business, and it's a little bit confusing why that's still being offered, because it has been very clearly put on hold. I wouldn't say it'll be banned, because I
Mhm.
think there is going to be some great value in that, but clearly they want to have more scientific study before it's approved for clinical use.
Gotcha. One last question is, how soon after one of these procedures can I get back to my regular activity? And when can I get back to playing pickleball or whatever it was maybe that caused the injury that got me to see you in the first place?
Perfect. Generally, for a shoulder, for overhead activities, we want restricted activity for 2 to 3 weeks. Then we want to check with you if the pain relief is beginning to take effect. It's a gradual effect. We want to start therapy, and then we kind of turn it over to the physical therapist when
Mhm.
you get back to overhead activities like pickleball. I would say in general, that's about 5 to 6 weeks before you're back fully. But remember, as opposed to a steroid injection, which might last for 2 to 3 months, this should last well in excess of a year. So
Mhm.
you're putting a little time up front to gain quite a bit more
Mhm.
athletic time and function on the back end.
Is that pretty similar with stem cell as well? Time frame?
Stem cell again takes a bit longer
Okay.
to show its colors,
Okay.
because it's a more complicated bloodborne type of anti-inflammation that it produces. Generally about 5 to 6 weeks. Then starting the therapy at that point and really getting back to activities probably around the 8th week. Once again, you're going to get a longer back end, hopefully in excess of 2 to 2.5 years, perhaps with a booster shot of a little PRP. And some folks, I have found that 90% of my patients do fine with one injection for over a year in most cases.
Mhm. Okay. And we did have somebody who commented in the chat about the fact that they had a meniscus uh, repair that got worse, and then they did PRP over two years ago and feels good. So it's good
Good.
to get a get a person saying that they've had this procedure and seen good results as well. So anything that we've missed, I know we've covered a lot.
That's a really typical case, and it's one of the things that 10 years ago led me down this road. Meniscus surgery, fix the meniscus, trim out as little as possible if it can't be fixed, should be great, just never quite recover. Do
Mm,
therapy, well treated, good surgeon, good surgery, happened to all of us, and it just didn't improve. I think that's a real role for
mm,
both PRP and stem cell. I think that was probably the initial indication that I use this for. Now I'll use it for throwing injuries of the elbow, for recurrent ankle sprains, hamstring and groin tendon and muscle injuries, many, many other indications, but probably first and foremost was the meniscus in the knee. So that's interesting someone would bring
mm.
that up.
Mm-hmm. Awesome. Well, anything that we've left out, I think we've covered a lot. So certainly, if they have other questions, they can comment later, and you can look at those, or they can call the office. So any final words?
I think not. I think it's just about keeping an open mind. I think one of the benefits of my practice at this point in the game is that you can have both surgical and non-surgical considerations that have a
Mm-hmm.
good healing and pain relief track record. So it's all about giving athletic patients options,
Mm-hmm.
and more options as we get older is good because, as we all know, uh, not all our options improve as we hit our 50s and 60s. So isn't it nice to know that we can do something that gives us a chance to keep being competitive in what we choose to do? I certainly feel that way in my 60s.
Awesome. Well, Dr. Cunningham, thanks for educating us all on the PRP and stem cell therapies, terms that many of us have heard about, but maybe didn't really understand all of the use cases and ways that it might be beneficial to us in the future. So this has been a great education. And so if you are watching live, we thank you for being with us tonight. And if you do have questions, feel free to post them in the comments, as well as go to OrthoBio.com is the website to learn more, or you can call the office at 512-410-0767. And we thank you all for those of you who've been live with us and for those who will watch the replay. Thanks so much and good night.
Thank you, Kim. Appreciate you moderating.